Let's take a look at this echocardiographic study of a young woman with valvular heart disease. At first glance, rheumatic heart disease comes to mind due to thickening and dumbing of mitral valve leaflets. Significant mitral and aortic regurgitation are seen here. However, this patient has a history of radiotherapy for non-Hodgkin lymphoma 20 years ago. Valvular involvement is also a known manifestation of radiation-associated heart disease. There are several echocardiographic features that can help differentiate between these two conditions. In rheumatic heart disease, the mitral valve is more commonly affected, while in radiation-associated heart disease, the aortic valve is more often involved. In rheumatic heart disease, the tips of the leaflets are most commonly affected, whereas in radiation-associated heart disease, the entire leaflets are more commonly involved. Chordal thickening is a characteristic feature of rheumatic heart disease, whereas in radiation cardiotoxicity it's less common. And left atrial enlargement is more common in rheumatic heart disease. Commissural fusion is a hallmark of rheumatic valvular heart disease, whereas it is uncommon in radiation-induced heart disease. Pericardial thickening and myocardial dysfunction are more commonly seen in radiation-induced heart disease. Significant myocardial dysfunction along with a decrease in GLS is seen in this patient. It can be due to radiation-induced cardiomyopathy. While rheumatic heart disease can also cause significant myocardial dysfunction, this typically occurs in end stage of the disease. LV dysfunction in radiation-related heart disease is primarily due to myocardial fibrosis or microvascular damage caused by radiation. Another helpful echocardiographic finding is involvement of the ascending aorta. Aortic wall thickening and calcification are commonly observed in radiation-associated heart disease. In conclusion, radiation-associated heart disease may be easily overlooked, especially since it typically manifests more than 10 to 15 years after radiotherapy. Patients may not recognize that these cardiac issues are related to previous radiation treatment.